our task today is, can we understand the exposures that lead to eczema development and flares to get upstream of these negative impacts on children and families and reduce the suffering? We want to start a conversation today that advances progress towards that, and ultimately we want to focus on solutions. I'm going to go ahead and introduce Dr. Maria Way, who is joining us from University of California, San Francisco. She's a professor of dermatology and the Comprehensive Cancer Center. She's staff physician at the San Francisco VA healthcare system, and her research group studies the effect of the environment, including climate change, on the skin, among other topics. So welcome, Dr. Way.
Thank you very much for that kind introduction. It is truly a pleasure to be here. I would like to share with you today some of the work that our group has done on the effects of wildfire pollution and the skin. So wildfire air pollution has a very complex and diverse composition, depending on what's being burned, whether it's biomass and or fossil fuels. Sometimes towns or dwellings are being burnt. Usually has gaseous pollutants such as carbon monoxide, and it has air pollutants such as polycyclic aromatic hydrocarbons, and it also has particle pollution. And today I'm going to focus on PM 2.5, which are particles that have the size of 2.5 microns or smaller. And here's a schematic from the EPA that shows a hair, and around that hair you can see blue spheres, which are PM10. Those are particles that are 10 microns and smaller. And then around one blue sphere you can see the red spheres, and that gives you an idea of how small PM 2.5 is. And basically it's composed of combustion particles, organic compounds, and metals, among other things. And PM 2.5 comprises 90% of total inhalable particle mass in wildfire smoke. These are schematics from Marshall Burke's lab in Stanford, and it shows that wildfires in the US are actually reversing previous air quality gains. This is measured by PM 2.5 matter in the air, and you can see on the left that since 2000, the air quality has been improving as measured by decreased PM 2.5 levels until 2015. When it starts to pop up again, especially in the Northwest and the West, and that's due to wildfires. And on the right, you can see that the percentage of PM 2.5 from wildfires is increasing in percentage in the total pollution over the United States. And again, it's really popping up in the Northwest and the West where there are more wildfires. Here's another schematic from that same paper, and it just really shows you graphically how over time since 2006 to 2018 the extent of wildfire smoke has spread from being confined mostly to the West and the Northwest to spreading over half of the United States. So why is wildfire air pollution increasing in scope? Here's a nice summary diagram from a review article in Nature Climate Change by Mora et al. Climate change is really being accelerated by greenhouse gas emissions. And this kind of shows you the downstream effects. And the one that I'm going to concentrate on today is fires at the lower right-hand corner. And what this doesn't show is the feedback loop to greenhouse gas emissions increasing from fires occurring. And here specifically shows you what's happening in the western half of the United States. There's been an increase in the number of fire weather days from 1973 to 2020, and that is defined as a day in which 2 consecutive hours the temperature reaches a certain threshold, simultaneously that the humidity decreases to a certain threshold and the wind speed is above a certain threshold. So you can see here over the western United States that specifically temperature has increased so that there are days in which the temperature is above 45 to 55 Fahrenheit. The dryness has decreased to a certain level and the wind speed hasn't increased. And you can see in the Sacramento, California area that there has been an increased average number of fire weather days from 7 days in the 70s to 22 days in 2020. So that's caused an increase in wildfires over the whole of California to increase in number, intensity, and duration. So you can see at the bottom of the slide in 2010, our wildfire season was from July to about September. Now we do not speak of a fire season anymore because the fires start in February, as they did this year, and can end in December, as they did in 2017. And you can see going across the x-axis that the number of fires have increased, and then the intensities have increased as judged by the height of the peaks. That is a measure of the number of acreages burned. So we were interested in my group to assess what the effect these increasing wildfires had on the air quality in a nearby urban center, San Francisco. So we took measurements off of a ground monitor. It monitors air, PM 2.5 levels. And you can see that in 2015, the air quality was quite good. But starting in the end of 2017 and through to 2021, you can now start to see peaks of PM 2.5 levels. And those are from fires that are from 50 to 170 miles away from San Francisco, are affecting the air quality in quite short bursts. So this data suggested to me to ask the question, what is the effect of short-term exposure to wildfire air pollution on the skin? So I developed an ecological study, and we compared the number of atopic dermatitis and itch visits to our tertiary care center in times with fire and without fire. And we chose to look at the 2018 Camp Fire that actually sadly burned down the entire town of Paradise. And we compared it to 2 previous years in which there was no fire, and that was 2015 and 2016. And you can see on the right that in the same 2 weeks of November 8 to 25 in 2015, 2016, there was no increase in PM 2.5 compared to when there was the Camp Fire. And so we looked at the total dermatology clinic visits, and that was 66,000. And we looked at how many atopic dermatitis visits there were 6,400, and we looked at separately the adult visits and the pediatric visits. We also looked at the number of itch visits, and there were 1,600 of those, and we also divided it between the adult and the pediatric populations. And total unique patient visits was 4,100. Here's our unadjusted data summarized. The black line shows you the average weekly PM 2.5 levels as measured by a ground air monitor, and the blue line, we measured the extent of the fire over San Francisco another way, and the blue line shows the measurements from a satellite that measures smoke plume density levels. And you can see that both the PM 2.5 and the smoke plume density levels are peaking over this 2-week period of the 2018 Camp Fire. And the dark bars show you the total average weekly visits for atopic dermatitis. And you can see that it's peaking the 2nd week of the fire and actually stays up for 4 weeks after the fire. There's an artificial depression in the number of visits of the week, November 22nd to 28, because that is the national Thanksgiving holiday in the United States. The lighter bars are the total weekly visits for itch. And you can see that also pops up in the 2nd week of the Camp Fire and remains elevated for the 4 weeks after the fire, with the exception of the National Thanksgiving week holiday. And so when we look at the pediatric visits for atopic dermatitis, we do see them significantly increased during the time of the fire as measured by 3 metrics. One is there or is there not a fire during the time that we're looking? The smoke plume density measurement from satellite, and the PM2 measurements at the ground level. And you can see that there's a 50% increase in visits for pediatric atopic dermatitis during the Camp Fire and for 4 weeks afterwards. And that's compared to the time when there's no fire. In addition, we saw that pediatric visits for itch also increased during the time of the fire compared to times when there is no fire, and that increased by 80% and was also elevated significantly across 4 weeks after the fire. We saw this same phenomenon for adults older than 65 years old, but we did not see this for adults aged 18 to 64. And interestingly, for itch in adults, we saw that 90% of the patients presenting for itch during the fire did not have a diagnosis of atopic dermatitis. That's compared to the episodes when there was no fire, when it was only 50 to 60% of the patients had no diagnosis of atopic dermatitis. We did not see this for the pediatric patients, but we think this is due to the fact that the fire is either unmasking previously undiagnosed atopic dermatitis or is irritating the skin of folks that don't have atopic dermatitis. And we're looking into that now. So the next question we asked is, what is the severity of the effects of short-term exposure to wildfire air pollution on the skin? So we looked at the number of prescriptions for medications for atopic dermatitis, and we saw a significant effect in the number of prescriptions for systemic medications for atopic dermatitis in adults. And this was mainly prednisone and Dupixent. And we saw a 50% increase. That was increased significantly for a few weeks after the fire. The next slide shows that we also saw increased number of prescriptions for topical medications for atopic dermatitis in adults, but that was not significantly increased. We don't have this data for pediatric patients because the numbers were too low to adequately assess. Finally, the question we asked is, how generalizable are these results? So do we see these effects with other wildfires? Because as I mentioned, wildfire air pollution is very complex and can differ depending on what's being burned. And in addition, we were wondering, does this effect occur in a population wider than what we're seeing in a tertiary care center? So here we examined the effect of the lightning complex fire, which occurred in 2020, as opposed to the Camp Fire, which was in 2018. And here you can see that it was a very intense fire. It burned 4 million acres in 2020. And you can see the PM 2.5 levels also bumped up. And this fire was approximately 50 miles from San Francisco. And this shows you the air quality at 10 in the morning on September 9th during the lightning complex fire over the city of San Francisco. And this shows you my commute that day. I commute along this road called the Embarcadero. It's right near the waterfront. To your right is the San Francisco Bay. And on September 9th at 10 a.m., this was my commute. So quite a dramatic effect on the air quality in San Francisco. So what we did was we looked at the search volume index, the number of queries on Google for certain search terms. And here's our unadjusted data. You can see the bars in this case are the average weekly PM 2.5 levels during the lightning complex fire, as well as some earlier fires. And you can see it peaks in September. And we took a positive control Google term and we searched smoke. And during the time, the dotted line shows you with the dots that smoke search queries track exactly with the PM 2.5 levels in San Francisco. And these were search terms that were done in San Francisco. And you can see that the blue line are the search volume for the term eczema, and it also peaks exactly with the PM 2.5 levels. And this is a significant finding. And the black line is the search for the term itchy. And again, you can see that it peaks with the PM 2.5 level peak. We searched a randomly chosen negative term on Google, and that was cup, and there was no peak during the lightning complex fire. Here's the adjusted data. We adjusted for relative temperature, humidity, and year. And you can see that with the bolded values that we saw a significant increase of the terms itchy, itchy skin, red skin, eczema, acne, wildfire smoke, all with the coincident with the PM 2.5 during the lightning complex fire. So in summary, wildfires are increasing in intensity and frequency and affect long-range air quality. I showed you data for California, but this is true all over the world for all continents except for Antarctica, including a non-continent, the Arctic has been burning as well. PM 2.5 air pollution is associated with exacerbation of atopic dermatitis and increased healthcare utilization for atopic dermatitis. Short-term exposure to wildfire air pollution impacts the skin health, as shown by increased visits to dermatologists for atopic derm and to itch in pediatric and adult patients greater than 65 years old. There's increased numbers of prescribed systemic and topical medications for atopic dermatitis in adults, suggesting that these are severe cases. And I didn't show you this data, but there's actually an increased number of visits for psoriasis after a 6-week lag time. And we note that there's a generalized increase in search terms that coincide with PM 2.5 increases. And these search terms are for eczema, itch, and acne during the fires. So I want to thank you very much for your attention and again for your invitation to speak here. And I wanted to thank the folks on this slide. These are all the folks that contributed to this work as well as my funders. Thanks so much.
Dr. Wade, for that incredibly thorough, innovative, and provocative presentation. Do we have any questions in the room or on Q&A? I was really intrigued by your finding that even in individuals who were not diagnosed with AD, you saw an increase in visits, I believe it was.
It's really was a surprising finding for us. We didn't really expect that at all. So it really gets to the question, absolutely, what triggers atopic dermatitis? So that's a study that we're engaging in now to understand that particular population. Do they actually have, for example, a history of atopic dermatitis in the family, or asthma or eczema, or do they have genetic signs and symptoms of perhaps having eczema, or are these truly patients that we can't really find any sign? And are you really at risk for irritation from air pollution if you even have an intact barrier, which would be also very new results as well. But I'm hoping to have some answers for that question in the near future.
As wildfires become more common, they're a threat to all of us, even if you don't have eczema potentially, by causing inflammation in the body.
Absolutely.
One more question in the room, and then we'll move to the next speaker.
Hi, thank you for your presentation. My name is Santana. I am a caregiver, but also medical student and board member here at GPER. Did you look at whether it was increased visits for people currently experiencing treatment and then versus new coming to see you for the first time, and then break down like the demographic, like if it was adults or the pediatric population as well?
It's a great question, and it actually is research that we are undergoing now. We are absolutely looking at the demographics very specifically. Is it triggering new visits to the doctor, or are these patients mild and now it's kicking it up? Certainly have all the data, and we are starting to look at that. I don't have the answer for you, but I hope to have that next year.
Okay, thank you for the presentation again.
Thank you very much.